We are back on Morning Line. Thanks for joining us. We're talking measles with Dr. Calvin Smith from over at Meharry. He's terrific. We'll take some phone calls here. The number's up on the screen, 737-7587. Real quick before we get to those, to give context, you talked a moment ago about how smallpox has been eradicated. Thank goodness. Smallpox no longer exists, as far as we know, except in some samples at the CDC lab stashed away, because of one thing: vaccines.
Right.
I got a smallpox shots when I was born. Yeah, it's been eradicated. Now, the reason we had more or less eradicated measles in this country.
We had.
Okay. But other countries where not smallpox, where measles exist, maybe, so you tell me, is the best guess as to why it ended up back in this country, and we see it now, is that there are folks who have traveled or have moved here from other places, brought measles with them, and the problem is, unfortunately here, there are parents who have not vaccinated their children, became lax, maybe for one or two reasons. Maybe one, they figure, oh, we don't need to anymore. I understand a parent saying, measles no longer exists. Why get vaccinated? I'd rather not put something in my child than something. I see that, if you believe it's all safe. The bottom line is, you know, they haven't done it. The measles comes in, these people aren't vaccinated, and boom. And here's the sad fact. There are parents right now in Texas mourning the death of their child, and you know who that's on? Them. And the reason that's on them, and not that they meant it, but they thought for whatever reason not to get it, which I'm sure that vaccine was available to them, and they made a conscious choice not to get it, either because they believe some of the stupid conspiracy theories against vaccines, or two, they maybe felt measles is no longer an issue. I'd rather not have my child vaccinated with some foreign substance. Either one of those two. Their child is now dead because of that choice. I mean, and it's horrible. My heart goes out to them, but I can only imagine how they must feel.
You know, a big part of it is on the medical community. We have to be vigilant about informing people. We don't spend enough time talking about why we do things in visits, and there are a lot of reasons for it. You know, many doctors are under time constraints that are either from their offices themselves or from the insurance companies, what have you. You know, where there's a push to see a lot of patients and to talk to them very briefly about the very minimal things. But things like this are very important. It's important to have informed consent, and the informed part of it is where we're lacking, where we're not really telling people the good, bad, and ugly about things. And all of our tests that we take prior to coming into actual practice tell us to be upfront, open, tell people good, bad, and ugly what's happening. We spend a lot of time trying to tell people the good because we think that's what's going to convince them, but a lot of times letting people know about the bad and what could potentially happen is just as important.
It's heartbreaking because that these infants died because of it. Let's talk about the difference too, Jess. Now, I know that, you know, the COVID vaccine became politicized, and there were those who said, well, they came up with that vaccine too fast, and we see people that made what? That was a bunch of hooey too. I've had every single COVID vaccine available, and I'm healthier than you are, okay? That's the bottom line. I'm fine, and I'm glad I had it. And by the way, knock on wood, I've never had COVID. I may have and didn't know it, but look, I've had everyone. But let's just be clear on this. If you're against the COVID vaccine because you think it was done too fast and we don't know what it does, measles vaccines have been around since 1957. And by all accounts, they are the most effective vaccine for any illness. It just does it. And the whole thing about autism has been debunked. But I mean, measles, we know that vaccine works.
It works.
Your child gets vaccinated, they're not going to get measles.
They're not going to get measles. I would put 2 weeks worth, a month's worth of my checks on the line.
Okay, whereas you could get a COVID vaccine and still potentially get COVID, and the whole idea, or the flu vaccine, still get that. But the idea is if you do get it, the symptoms will be far less because you've had the vaccination. Is it the same with measles, or if you have the measles vaccine, the odds are you're not going to get it?
If you had a measles vaccine, the odds are you're not going to get it.
It's that effective. Any side effects that we know of? Besides a sore arm and maybe achy for a day?
So we know that, you know, the variation in the way that the measles vaccine is created, people who are immunocompromised or actively going through an illness shouldn't get it just simply because their immune systems aren't going to take fully to it. But generally, no. But before this, and I have to emphasize and say it because there's not too many things I get super passionate about, but lies are one of them. Before the lie of that story came out, that tied it to autism, there was absolutely nothing. There was absolutely nothing associated with it. It was a very, very, very safe and effective vaccine. It's called the MMR because it contains 3 of them. And, you know, the measles, as we talked about, is so contagious. Like it was, like, you know, the polio vaccine vaccine is the breakthrough. That's the one that we hang our hat on.
Sure.
And I would say is very important. But for me, in my eyes, the way that we responded to measles and smallpox was really, really the scientific breakthrough and the proof that vaccination, especially with herd immunity and getting people as communities, it really helped us to study how things transmit in communities, how people get things, from just small interactions, all those kind of things. Now we know a whole lot more about it. And because we know so much about it, that's the tragedy of it. Because this is 1,000% preventable. 1,000%.
All preventable.
Yeah.
All right, so folks, it's science. It's been proven over decades. Get your face out of the bull that you find on social media. Stop listening to nitwit celebrities that don't know what they're talking about, and believe in science, or your family may face tragedy. It's that simple. And there are families right now facing horribly tragic circumstances in Texas that could have completely been avoided. And by the way, we do know there's been at least one case reported of measles here in Middle Tennessee. I assume it's in a child. And hopefully that child will be okay, but that child could have been prevented from having this had he or she been vaccinated. It's heartbreaking. Let's go to Ronnie. Ronnie, good morning. Hi, Ronnie.
Good morning.
Morning. What's on your mind, buddy?
I got a question. When I was a kid, I took sugar cubes. Is that the measles shot?
Well, I'm sorry, what was it again? What was it called?
What? Sugar cubes.
Oh, that's polio. That was the polio vaccine.
Okay, well, I'm 68 years old, and how do you know what kind of shots you had when your family's already dead almost?
Yeah.
Hey, great question. That's a very good question.
Yeah, Ryan, that's a great. Actually, Nick and I were discussing that over the break. And so the best way to know is to get a test called a titer. Okay. The titer will be able to check the amount of immunity you have to the measles, to mumps, and rubella. And there's a way that we can look at your blood and tell, okay, these cells have been educated into how to deal with this. And usually there's a cutoff number. If you're below that cutoff number, you get a booster.
There you go. So you can go to the doctor, say, I want to have a titer test to find out. Depending on your age, again, if you're born prior to 57, then you probably need to go get a booster. We should say, by the way, that, and I actually called on this, and I'm going to probably do the titer now, because I want to make sure there's vaccine available for others, so I'll have that checked out. Is that pretty easy? Does the test come back pretty quick?
Yeah, it comes back. It comes back pretty quick.
Next time I go in to have my cholesterol test, can I tell them to go ahead and do the titer test?
You could absolutely do that. Usually the turnaround, because it hadn't been a common test, usually turnaround for our clinics are about 24 to 48 hours.
That's fine. Yeah, I just wondered.
It's a send-out test, but nonetheless, it comes back really quick.
Okay, that's great. Well, and I was going to say, I did call Walgreens to check on this beforehand. That's where I've gone to get my other vaccines. And they said they expect to get a supply in maybe sometime in April, which is just tomorrow. But I just wonder, you think there's a shortage, or is it, what's the story with the vaccines? When you say there's maybe not enough, is it because there's a run on it now because so many people are freaking out realizing they hadn't, or was there just not much made? I'd
say it's a combination of both. I think, since this has been in the news, certainly people are getting the vaccine in their forefront of their mind and figuring whether they need to get it or not. So there's that. But then, the fact of the matter is, because it was typically confined to childhood, we would give it to kids. And so the amount of vaccine available was pretty much for the predicted population of children, school-age children, who are going to be around other kids.
Okay. All right. So it may be coming in, a little bit.
Yeah. I mean, it's not something that is very difficult to make, from what I understand. So it's not like, with the COVID vaccines. This was novel. It was new. The measles has been around. It's an old school player. It's been around for a long time. It's been around for a while. And, it's just a matter of supply and demand and economics and all these kind of things. They'll make enough of it.
All right. Let's take a call from Ann. Ann, good morning. Hi, Ann.
Good morning. You may have already answered my question. I was born in 57. I have a compromised immune system and have known about it for 40 plus years. So are you saying that I should or should not, based on my immune system, have the booster done even if my titer is low? I go to the doctor next week, and this is something I really want to keep a check on because I am around school-age children a lot.
Yep.
And it's those children that have not been given it that I'm concerned about being around.
Absolutely.
So the information on whether or not I should take a booster is conflicting. I hear it one way and then I hear it another, and I trust your judgment, so I'll listen.
Thanks so much, Ann.
She's in a little middle ground there. Her age makes her that she should, but she's immunocompromised. How does she balance whether she should get it or not?
I tell you, every time I get a call from you guys, Ann is the first person I think of.
Yeah, she's great.
Yeah,
I mean, it's a good question.
And
too.
she's the perfect person for this conversation. So my advice to you, Ann, is this: I would ask your doctor, because you go to specialists and things like that, I would ask for a titer. Generally, if you're under chronic immunosuppressive therapy, you're getting medications that may lower your immune system, there still is the chance that you have enough. The vaccines, especially if you got it in that window period, were robust enough to give you lifelong immunity, even with the things that are going on now. But the best bet, the best thing to do right now, if you have like a window of time, especially since we know there's an outbreak or potential for an outbreak here in Middle Tennessee, is to get your titers done. I think your doctor would agree to test the amount of immunity you have, and then from there, if your titers are low, that's the indication to go ahead and get.
And
the
it's
booster.
a balancing act.
Yeah.
If she is immunocompromised, getting a vaccine, because of that, is that going to maybe make her feel a little more achy for a few days? Or
the bigger concern would be whether she would take to it or not. I think.
What do you mean, like whether it would work?
If it would get her numbers up to where it needs to be.
It may not even do that, depending on how.
That's the bigger. And we do know that because of the way that they formulate the vaccine for measles, mumps, and rubella, that sometimes there is a seroconversion. Sometimes people do get it.
Okay.
And so we want to make sure, but her doctor, a doctor that is like a rheumatologist or an infectious disease doctor is usually pretty well versed and knows, what the risks versus the benefits are for those patients, particularly. When you get boarded and licensed for those specialties, you really have a rigorous understanding of like what your patients should and shouldn't get, even if in the worst case scenario there's an outbreak. Like, unfortunately, the way we have to think about things, we know that even though we've eradicated these diseases, we still study them and learn about them and know, if there's an outbreak. Like TB is a big one. TB waxes and wanes, but it's still here. It's still around. So we have to know how to deal with it when we see it. And the measles, we spent a significant amount of time learning about it because it had been, from an epidemiology standpoint, pretty predictable in terms of how we could deal with it.
Take a break on that note. We'll be back with more right after this. Stick around.